Breastfeeding is often described as a natural and beautiful bonding experience between a mother and her baby. But for many moms, especially in the early days, breastfeeding can be painful and frustrating. If you're experiencing pain while breastfeeding, you're not alone, and most importantly, it's not something you have to suffer through. One of the most common reasons breastfeeding hurts is an improper latch. When a baby is not latched deeply onto the breast, the nipple can get compressed, rubbed, or even cracked. Pain during feeding, pinched-looking nipples after a feed, or clicking sounds while your baby nurses are all signs of a shallow latch. The solution often starts with positioning. Make sure your baby's mouth covers not just the nipple, but a good portion of the areola, with lips flanged outward and the chin touching the breast. Another frequent cause of breastfeeding pain is sore or cracked nipples. This usually develops from repeated poor latch, frequent feeding without proper healing, or dry skin. Applying a few drops of breast milk to the nipples and allowing them to air dry can help. Medical-grade lanolin or nipple creams recommended by healthcare professionals can also provide relief and support healing. Breast engorgement can also make breastfeeding uncomfortable or painful. When breasts become overly full, they can feel hard, tight, and tender, making it difficult for the baby to latch properly. Feeding your baby frequently, expressing a small amount of milk before feeding, and using warm compresses before nursing can help soften the breast. Cold compresses after feeding can reduce swelling and pain. Blocked milk ducts are another reason breastfeeding may hurt. These feel like tender lumps in the breast and can cause sharp or aching pain. Gentle massage, frequent feeding, changing nursing positions, and ensuring the breast is well emptied can help clear blocked ducts. In some cases, pain may be caused by infections such as mastitis or thrush. Mastitis often comes with flu-like symptoms, redness, and intense breast pain, while thrush may cause burning nipple pain and shiny or flaky skin. If pain persists or worsens, it's important to seek medical advice promptly. The good news is that breastfeeding should not hurt long-term. Pain is a signal that something needs adjustment. With the right support, whether from a lactation consultant, nurse, or doctor, most breastfeeding problems can be fixed quickly. Remember, every mother and baby pair is unique. Be patient with yourself, ask for help early, and trust that with the right guidance, breastfeeding can become a comfortable and rewarding experience for both you and your baby.